Hello and welcome to the latest edition of the Infinicast. I'm Derek Fenwick, the Director of Professional Development at Infinity Rehab, and I'm joined today by Mike Billings, the President of Infinity Rehab. And we're going to talk a little bit about the IMPACT Act. It's a newer piece of legislation that builds on some former legislation in our country regarding healthcare, and is really going to kick us into 2016 and beyond, right?
You bet.
So what kind of led up to the IMPACT Act of 2014?
Well, a lot of things. When you look back at our industry, we've been Infinity's been around for 15 years, but even before that, there was some significant legislation that really kind of spawned our industry. So, for example, back in 1987, the Omnibus Budget Reconciliation Act, OBRA, really changed nursing homes in terms of, created the Nursing Home Bill of Rights, brought in a lot of quality measures, drove, restraints out. And for us in therapy, it also required that every patient, every resident of a nursing home function at their highest practical physical level.
Right.
So that opened the door for our services to come in. And then 10 years later, 1997, you had the Balanced Budget Act, which was an attempt to kind of bring costs down in our sector, and that changed our industry quite a bit, and we're still living with a lot of that today as far as the prospective payment system.
It's the world we know. Right?
It is. Therapy caps. So, and then like you referenced, Derek, just most recently the Improving Medicare Post-Acute Care Transformation Act, otherwise known as the IMPACT Act.
Yes. Yeah. That's probably why they call it IMPACT.
Exactly.
It's a little easier.
Exactly. So that's the latest legislation, and that was just signed just October 6th by President Obama. So I think what was interesting with the IMPACT Act, and we'll get into more of the details, but when you look at, I think we've all been a little bit frustrated with kind of the lack of activity and in our government.
Right.
This thing was introduced in June. I think there was an early draft in March, but it was really introduced to Congress in June. Fast tracked, both bipartisan, bicameral support, signed by the president in October.
Wow.
So there's obviously a great deal of interest in.
Great deal of interest. Clearly, they see some advantage to the IMPACT Act, getting going quickly. Right. And this is really focused on post-acute care, right? It is,
and I think it's first you got to recognize, well, what is post-acute care? And one of the things in this law now is that it actually defines who the post-acute players are. So long-term acute care hospitals, inpatient rehab facilities, skilled nursing facilities, and home health. So those are your four settings that are lumped together in post-acute. And the goal with the IMPACT is to try to control quality and costs, across those settings.
Yeah, that's what I was going to ask. Is how is this going to impact those different care settings and the individuals that provide care in them?
Yeah, I mean, that's a great question. It's very detailed. When you read through the law now, I think the biggest thing for us, and when I go back and compare this to OBRA and the PPS and so forth, Balanced Budget Act, I think what we're going to look back on this and see that this was on par with, in terms of the impact, I guess, pun intended, in our industry, in that it is bringing a level of standardization that we've never seen before. And that was one of the biggest drivers and kind of frustrations with Congress in looking at our setting, is that there's so much variation from setting to setting to setting in terms of how things are measured, how's quality measured here, how reimbursement system is different for this setting versus this one, even though a lot of times the patients are fairly homogenous, across the settings. The quality reports and reimbursement levels were all over the board. So this is a major step in bringing standardization to both quality and then eventually reimbursement.
Yeah, so when I hear standardization, I hear collecting data. I mean, you have to be able to collect some common pieces of data to then measure and standardize, right?
That's exactly it.
And you started to speak about the data points a little bit, that they're going to be within quality, within claims data.
Right.
What can you elaborate on that a little bit more?
Yeah, you bet. I mean, so this act is not looking to create brand new tools in all these settings. Every setting already has, SNFs have the MDS, and home health has the OASIS and the IRF-PI and patient rehab and so forth. So they're looking to maintain those tools, but to modify them, portions of them. So for example, for us in physical therapy and occupational therapy is to take the functional and ADL components of each of those tests, standardize those sections so that we're all measuring the same data elements across all settings. And the goal for that is to, by October 1 of 2018 for SNFs and inpatient rehab and long-term acute care hospital, is to have that standardized. But even before that, you know, so you're thinking, well, 2018, we got a few years, but really by 2016, SNFs are kind of on deck to start reporting some quality elements on falls and functional status.
Yeah.
And that's October 1 of 2016. So that's not that far away.
So that basically means 2015 is preparation time.
That's right.
And then you really have to know that you're going to succeed come October 1st of 2016.
You do.
To really be in compliance, not only be in compliance, but also kind of thrive under this new Impact Act.
That's exactly true. So you can't just wait until September of 2016 to start thinking about this. It's a lot of preparation over the next, like you were saying, the next year and a half, and that's stuff, something we're working on here at Infinity is, you got to look at it from an organizational standpoint. Do you have all the pieces from an organizational structure? Really adding more kind of quality and outcomes resources to your organization. But I think just as important, or probably more important, is the organizational readiness of your workforce, of your therapists, because this is a very, you and I are both PTs, and we appreciate the autonomy that's in our practice, and this is a little paradigm shift for in that area.
Yeah, and there'll be some reporting that kind of comes not only back to Congress, but also there's going to be some public-facing reporting, right? So they can kind of start to the individuals that are receiving care from these clinicians that are kind of moving into the standardization world are going to be able to look at that. I mean, the 5-star rating that skilled nursing homes already have is kind of one example of that, right?
That's exactly it. Yeah. So your question is good. It's kind of where's all this going,
right?
And public reporting is one, definitely. So by October 1 of 2018, the goal or the law, this law requires that there be public reporting of quality measures in skilled nursing and inpatient rehab and long-term acute care. And then by June of 2016, this law requires CMS and MedPAC, which is the Medicare Payment Advisory Commission, and they report to Congress. They're required to come back to Congress with some recommendations on new payment reform. So that's really where a lot of this is going. Yeah, we got to, the goal is to increase quality in all these settings, but it's also to ultimately lower costs and come up with a payment system that's not based on the setting anymore, but it's based on the individual patient.
Yeah.
So that's where this is heading.
Yeah, and as a clinician, that's exciting. I mean, for me, that's exciting.
Or scary.
Or scary. Yeah, to kind of move away from that quantity-based into a quality-based where you're really kind of reflecting the care in the reimbursement and being able to kind of have that continue to feed the system.
That's exactly it. Yeah.
That's great.
Yeah.
Well, thank you for talking about the Impact Act with me today, Mike. Happy holidays to you, and thank you for joining us for this edition of the Infinicast.